Hi, I'm Sandy Bell. I'm a massage therapist of 26 years. I'm going to show you how to massage somebody that has pain associated with an asthma attack. This massage is for after an asthma attack, not during an asthma attack. Muscles are involved in inhalation and they get fatigued. They can even get torn depending on how severe the asthma attack is. So this technique is for anybody who wants to do it. It's not just for massage therapists on somebody who has pain associated with an asthma attack. Use your full palm as if you were going to rub a child's back, or if you were going to pet a dog or a cat. That full hand pressure is what's going to feel comforting and calming to the nervous system. Once you're in there, go ahead and do a little bit of pressing. We don't want to press firmly onto the rib cage, so be careful of your pressure. What you want to do is just take the skin and kind of move it with you to warm up the area. So all we're doing is looking to create some blood flow to the musculature that has been affected by the asthma attack. After you have your full hand down, just go ahead and hook your fingers in and then start circling directly over the rib cage. We're just going to get the blood flow to the muscles that are called the intercostal muscles. These are muscles that are in between the ribs. And as we work down here, we're getting closer to the spine. Do not directly press on the spine. Not too deep. Getting the muscle that we call Serratus Posterior. To the upper back. And you can just give some firm pressing down right over this bone we call the scapula. In between, next to the spine, but not directly on the spine, we'll travel up. This is where we're going to find Serratus Posterior. That's up here, and we'll just go ahead and do these circles. So all I'm doing is circles like this on the musculature. I'm pressing down and then coming out with pressure. Press down, come out. Press down, come out, press down, come out. And then you can do it a little bit faster. We're just looking to get the muscle tension out of the area. Come on to the neck. One of the muscles that's really affected with an asthma attack are the scalene muscles. They are in the neck. So don't hook your fingers in. Just use a flat surface of this part of your hand and do some nice circles in here. You can pull the shoulder down to create space. How's the pressure, Isaiah? Good. We're just looking to relax the muscles. If it hurts, they may tense up, and that's not going to be effective. So here we're just doing one side of the back, but you should do both sides. Go ahead and turn over, Isaiah. So the other muscles that are involved in this are the diaphragm, pec major, pec minor. Scalenes we can get from this side as well, and serratus anterior. So we're just going to go ahead and sink in and circle. On a female, you'd be a little more cautious not to touch the breast tissue. So your stroke would be from here to here. That's all we're doing, is we're sinking in a circle. Bring this over to the arm. Pulling. So hook your fingers in and glide. This could be ticklish to some people, but if they're sore in there, it probably won't be ticklish. It might hurt a little bit. But again, we don't want to use too much pressure. Is that okay, buddy? Yeah. Our big palm circles again. Just relaxing these muscles. Muscle is in the abdomen, so we want to be really careful, but if you do want to address it, Don't press in too hard, but you can come just below the rib cage and give it a little rock. So you're hooking your fingers into the rib cage and then just give it a little rock. For an experienced massage therapist, you'll go deeper in here and you'll do more specific work, but this video isn't specifically for MTs. Feel comfortable, you can come down to the neck. The scalene muscles are in here, so we can take our circles again, sink our finger pads in and circle. You'll probably feel them pop underneath your fingers. Just make sure you're not applying too much pressure, and definitely check in with the person that you're working on. Is this pressure okay?
Yeah.
There is a nerve bundle in here, so if you hit it, it will send a sharp shooting pain down the arm. You want to avoid that area. Just little circles in here. Another muscle that can be affected is called the Sternocleidomastoid Muscle. I'm going to just have you work on the attachment of it, because that's the easiest part of the muscle to get if you're not a practitioner. So just below this part of the ear, sink your fingers in and circle. Shoulders a little pressed down. If you're working on a male, you can place your hands right down on the chest and give it a little push. I don't recommend that on a female. Video for treating muscle problems related to asthma. Thanks for watching.